Thank you, guys. Good morning and welcome to our show, Dr. Johnson. Your name was stumbling. I was stumbling on your name. That must be what you were talking earlier.
Yeah,
about plasticity or elasticity of the brain.
Plasticity.
All
yes.
right. What
Yes.
about the elasticity part of it?
Well, the elasticity refers more to our skin and our joints and our spine.
Than the brain.
Yeah.
So the brain is a plasticity issue.
Yes.
Is that like the plasticine that children play with, that you can create any shape, form with it?
Well, that's where the term comes from, yes.
Interesting.
Yes, things that are plastic are shapeable,
Malleable.
formable,
Yes,
malleable.
malleable.
Yes.
Yes. So welcome to Conversations with Dr. Johnson. And we introduced it by having a joke that we had offline continue. But today we're going to talk about a very fascinating topic, especially to me, to Dr. Johnson, and to people like us who are, even in our old age, being very youthful. We want to know, what is the trick, right? So today Dr. Johnson takes us through the minefield of hormones. So Dr. Johnson, why is hormone such a fascinating topic?
Well, for several reasons. One of the main reasons is that hormones control most of the activities that take place in our body on a microscopic level. Have you ever stopped to think that one single human being, all at the same time, can play a piano, sing a song, look out the window, look at the moon, digest food, eliminate toxins, and if it's a female, be creating a baby in her body all at the same time?
I thought that was called multitasking.
Well, our body is excellent at multitasking.
But not us.
Largely because we have hormones. Hormones are like the symphony conductors that are orchestrating all of this, so that it can happen at the same time and all be coordinated.
With more members of the symphony than you would have in a typical orchestra.
Yes, yes, yes.
Because just think about your heart. You said there were almost how many millions of mitochondria in the heart?
Well, there's about 10,000 mitochondria per cell in
Per
your heart.
cell.
Yeah.
Wow.
Yeah.
So I was millioning it already.
Yes, you were millioning it. We just created a new word.
Yeah, and somebody has to conduct all of that.
Yes, and that's your hormones.
In rhythm.
Yes.
Guys, there you go.
Yeah. So the other reason this is so interesting and important is simply that declining hormone levels is one of the main causes of medical problems, okay? Most medical problems are some combination of stress, present or past, nutritional deficiencies, hormonal deficiencies, or toxicity. So hormones are one of the big four. And if you can imagine right in front of me a big graph. Now at the bottom of this graph we're going to have age. Over here is birth, age 25, 50, 75, 100. And up here we have high youthful healthful hormone levels till about age 30, followed by a long steady decline. Okay? And
at the minute you said age 30, Karen was panicking because she's in the hormonal decline stage now.
well, that's where it starts.
Exactly.
Yeah.
So just take notice.
Now, on this same graph, we're going to draw another line that shows our risk of a major chronic disease.
Yes.
That line is very low up until about age 30, and then it's a long, steady increase. So, high hormone levels correlate with low disease rates. Low hormone levels correlate with high disease rates. Okay? And we are genetically programmed to have declining hormone levels starting at about age 30, so that we will grow old and die and make room for the next generation.
Wow. Is that why?
Yes.
Then why do some people like me want to live forever?
Because you don't want to.
Well, because you're enjoying life and you're good at it.
I thought it's because some of the people don't deserve to be here, so I should occupy their space.
It's a lot.
I'm not sure we want to go down that road.
No, we don't.
So, why are we genetically programmed to have declining hormone levels starting at around age 30? Because Mother Nature considers that as humans we have one job only. That is to guarantee the survival of the species. How do we do that?
Procreate? Yes.
How do we do that? We do that by having children. And worldwide, most people who are going to have children have done so by about the age of 30. So Mother Nature considers that about the age of 30, we've now done our duty.
And therefore get out.
Yeah, put us out to
Excellent.
pasture so we can grow old and die and make room for the next generation.
Wow.
Well, I personally got a very late start at fatherhood. I've got 2 teenagers at home. So in my house, we're not happy with that plan, okay?
In my house, we are trying to put the plan in better acceleration. Well, because in my culture, from African Cameroon, girls get married at 15,
Sure,
14,
sure,
and they have babies. Almost by the time they're 20, 25, they've had all their children.
sure, sure,
And what we found out that those children are actually very strong,
sure.
because it's like women are at their prime at those ages to have kids.
Sure.
And their hormone levels are...
Young, vital eggs and sperm and hormone levels.
Exactly.
Absolutely.
Very, very important.
Yeah, absolutely.
All right. So we get to 30, well, 35. Sorry, I'm trying to be fair to my daughter, Karen. So we get to 35. So what happens now at 35? We're in this decline. Yes, you want to ignore that. We're in this decline. And what actually happens?
Well, it depends on, see, all the hormones tend to start declining at about the same time. Now, there are literally dozens and dozens and dozens of hormones in the human body. Right now, we're mostly talking about what I call the big 5: estrogen, progesterone, testosterone, DHEA, and thyroid. Okay?
And next time we're going to talk about the others. That's not the all. Just today we want to
Yeah.
focus on those big 5.
Yeah.
All right. Go ahead, Dr. Johnson.
Okay. So I like to give each of these hormones nicknames. Okay? Estrogen's nickname for me is the female hormone. When women go through puberty, estrogen helps them to develop breasts and hips and what we think of as the female curves and secondary sex characteristics. Progesterone I call the pregnancy hormone. Without progesterone, a woman will not be able to carry a pregnancy to term. She will have a miscarriage. Now, a lot of people watching this are well past the age where they want to have babies. So why on earth would they be interested in progesterone? Now, keep in mind here, everything I'm talking about here today is bioidentical hormones. These are hormones that are a perfect match for what your body produces but has now become deficient in, as compared to synthetic hormones, which are similar but not identical. They have some of the similar benefits, but they also have potentially a lot of side effects. So bioidentical progesterone is an anti-stress hormone. It's an anti-anxiety hormone. It's a powerful anti-cancer hormone. It helps keep your bones strong. If women or men have migraines, they can rub progesterone on their forehead and usually make the migraine go away within minutes. If they have osteoporosis, say in their right hip, they can rub progesterone cream over their hip and make their bones strong. So
Yeah, but you told me something different when you gave me progesterone. You said it will make me smarter.
well, if you rub progesterone here, it actually stimulates the production and activation of stem cells in the human brain.
There you go.
Okay?
There you go. That's why I rub that every night.
And so my family has strict instructions. If I'm ever in the ICU, I've had a bad head injury, they sneak in and rub progesterone cream all over me.
Good to know.
Okay? Because there are many cases where people have had bad head injuries, they've been in deep comas, expected to never wake up. They got the progesterone, and the next morning they're sitting up awake and talking.
Wow.
And,
Miracle.
and if I recall correctly, the research confirming that is going on at Emory University in Atlanta.
Wow, that's wonderful things to know. Progesterone. And this would come typically, this is the bioidentical
Yes.
progesterone.
Yes.
And it comes like an oil or liquid, right?
Well, there's several ways you can get progesterone in your body. If you want to get progesterone throughout your entire system, which in many cases you do, you need to take it in a pill or under the tongue.
Okay.
If you want to concentrate it in one specific area, then you rub it on your skin and most of it stays in that area. Another thing we use this progesterone for is to shrink thyroid nodules. It's usually quite effective for that.
Yeah, one of my friends sent me a message actually about that with thyroid nodules, whether they should be on thyroid medication or not. So you think just taking the progesterone will shrink those nodules?
Well, but the presence or absence of nodules has nothing to do with whether the patient has normal thyroid function or low thyroid function. So certainly many people with thyroid nodules have low thyroid function, but we haven't made a connection. We don't know that the nodules actually cause the low thyroid condition.
But you said using the progesterone would help.
Help to shrink the nodules,
okay.
not necessarily to restore normal thyroid function.
Levels. Okay,
yeah.
Wonderful.
Yeah.
So we've spoken about progesterone.
Yes.
But you didn't, when you spoke about estrogen,
Yes.
you didn't talk about the application, the bioidentical application for estrogen.
Okay, so bioidentical estrogen gets rid of hot flashes and night sweats. It gets rid of vaginal dryness. It helps keep bones strong. And critically important, it helps preserve memory. Women with low estrogen levels are much more susceptible to memory loss, dementia, and Alzheimer's.
Is that why they fight a lot, cause trouble at home, because they forgot and they think they remember?
Sure. Keep thinking that way, Charles.
Yeah, so I think giving them estrogen is going to be a good thing. All right. So now we've talked about progesterone, we've talked about estrogen. Now let's go to the next one. We have three left. Testosterone.
Yes.
Even the name itself sounds powerful.
Well, everybody thinks that testosterone is the sex hormone, but if you think of it that way, you are missing the big picture. It is much more accurate to think of testosterone as the strength hormone. If your levels are low and you restore them with bioidentical testosterone, you will have stronger bones, stronger muscles, stronger heart, stronger energy levels, brighter mood, and then we get to the, for men, better erections, and for both sexes, stronger sex drive. So there is a sexual aspect to this. But if that's the only thing you're focused on, you're missing the big picture.
Yeah, but you'll be getting the other benefits like side effects. I mean, those benefits will come like side effects.
Yes, however, I have had many women tell me, you know what, my husband died, I don't have a boyfriend, I have no interest in sex, I don't want testosterone. So they're missing the big picture.
Yes.
There are all these other important benefits.
It's a very important point you made there, yes. Yeah. Some women say the same thing about estrogen also, that I don't need it anymore for some of them who don't have symptoms. So that's very interesting.
Well, listen, there's been a lot of information out there that has scared women away from estrogen because of the so-called cancer connection. The reality is, synthetic estrogen, which is what most mainstream doctors prescribe, does increase your risk of cancer, okay? Bioidentical estrogen, when properly prescribed and balanced with bioidentical progesterone, bioidentical estrogen actually can lower your risk of cancer when it's properly prescribed.
Okay, interesting. So we've done three now: progesterone, estrogen, and testosterone. So
Yes.
we have two left.
Okay, so next is DHEA.
DHEA.
Dehydroepiandrosterone.
No wonder we call it DHEA.
No wonder we call it that.
Yeah,
Yes.
we wouldn't be able to remember that.
DHEA is the longevity hormone, the immune strengthening hormone, the anti-cancer hormone. Okay? Now, with all of the other hormones we're talking about, there are short-term benefits in the sense that I feel better when I take this. And there are long-term benefits like keeping your bones strong, preventing cancer, and so on. With DHEA, we don't normally see any short-term benefits. In other words, people don't feel any differently when they take DHEA or when they skip their dose. So we take it for the long-term benefits, not because we're expecting it to make us feel better.
But wow, imagine those benefits.
Yeah.
If you're not taking DHEA, you might have to exit sooner to make space for those other people coming.
Yes. Now, you can buy DHEA at a health food store. You can order it online. The question is, should you? And the answer is no, you really shouldn't, for a couple of reasons. Without a doctor's supervision with before and after testing, you have no idea if you're taking the right dose.
Yeah.
And much of the over-the-counter DHEA is very poor quality, it's poorly absorbed, it's inconsistent. Your level may go up one day and not the next day. So you need the pharmaceutical grade, and you need a holistic doctor, a functional medicine doctor who knows how to do the proper testing. If your doctor just does a DHEA level on you, unfortunately, that won't tell us anything. We have to do a specialized version of it called DHEA sulfate. And most mainstream doctors are not aware of that distinction. Okay. And you have to have that distinction in order to know what your proper dose is, do a follow-up test, and make sure that the dose is doing exactly what you want it to. The dose can range anywhere from 5 milligrams a day to 100 milligrams twice a day. Now, most women need 25, most men need 50, but there's a wide range, and only with testing do you know if you're getting your levels exactly where they belong.
Yeah, I used to take the DHEA 5 milligram until you told me the other day.
Yeah, that's a baby dose for a man.
Well, thank you for recognizing what a man I am. So I'm now at 50, or should I go to 100 since I'm twice a man?
Take it 50 milligrams every morning after breakfast for a month. Retest your DHEA level 6 hours after your morning dose. Okay. And don't miss any doses for a week before the blood test, and then we'll know if that's your dose or not.
Okay, wonderful to know.
Yeah.
Now we've done progesterone, we've done estrogen, we've done testosterone, we've done DHEA. So we're going towards the last one.
Thyroid.
Thyroid hormones.
Yeah, if I had to choose a favorite hormone, it would probably be thyroid, because thyroid is the master metabolism hormone, okay? If your thyroid is low, your metabolism will be sluggish. And there's a huge long list of possible symptoms that you'll get if you have low thyroid. Not everybody gets all of these symptoms, but this is the list you get to choose from. It's things like palpitations, things like headaches, things like cold hands, cold feet, tendency to hypoglycemia, elevated cholesterol levels, overweight, difficult weight loss, fatigue. Now, over the years, I've had a handful of patients who had low thyroid and had excellent energy levels. We don't understand how that works, but we know it can happen rarely. So if somebody has all these other symptoms of low thyroid, but they say, but my energy level is fine, I couldn't possibly have low thyroid, it's still possible. Okay. Other symptoms of low thyroid are things like dry skin, tendency to constipation, tendency to hair loss, loss of libido or sex drive. If a patient has low thyroid and low testosterone at the same time, and it's very common, we see it all the time, if we don't address both the low thyroid and the low testosterone, likely their libido is not going to come back.
Wow.
You have to address both of these.
This should be a national emergency on this issue.
It should be.
Yeah.
But it's not.
Yeah.
There's also things like depression, anxiety, irritability, trouble sleeping, sensitivity to hot weather, sensitivity to cold weather. And for women, it can also be things like irregular periods, painful periods, PMS, miscarriages, and infertility. All of these things are classically caused by low thyroid. So I'm sure some of our listeners were checking off several of those going, wow, I've got 15 of those symptoms, or 18 or 20. And so yes, odds are you have low thyroid. Now, why is low thyroid not more commonly diagnosed? Well, there's a couple of reasons. Number one, mainstream doctors almost never do the state-of-the-art thyroid testing. It's expensive. Insurance companies usually don't pay for it, so they just don't do it. And so they do the old-fashioned inaccurate testing, and it comes back and they say, yep, see, your thyroid's fine, have a nice life, don't worry about it. But with the state-of-the-art testing, we can get much more precise and accurate information. Yeah. Now, the other thing that happens is that many people with multiple symptoms of low thyroid, even with state-of-the-art testing, will come back with low normal readings. And mainstream doctors say, yeah, you're low normal, that's fine, don't worry about it, have a nice life. Well, if you've got 10 or 12 or 15 or 20 symptoms of low thyroid, then you aren't doing well with a low normal reading. And we need to give you just enough bioidentical thyroid to get you up to high normal. Not high. We don't ever want to overdose anybody on thyroid. That's not a good thing. But just enough to get you into the higher end of the normal range.
So will those people take supplements, or they would have to do something like liposomal or a cream, or
IV.
what would be the best way to get
Well,
these people bioidentical?
Bioidentical thyroid is normally given as a pill you swallow each morning.
Oh, okay.
Yeah.
All right.
Yeah.
Okay.
Now, the final issue is that if and when mainstream doctors do diagnose a low thyroid condition, they will almost always prescribe Synthroid, which is synthetic thyroid, and it simply doesn't work as well. I've had many, many patients in my practice who were diagnosed with low thyroid many years ago. Their doctor put them on Synthroid. They keep going back to the doctor saying, yeah, this Synthroid isn't really helping me. Can we do something different? And the mainstream doctor will say, no, your thyroid is fine. Stay on your same dose and don't worry about it. And then they come to me and they still have all these symptoms of low thyroid. We switch them to bioidentical thyroid, and now they feel better and they're healthier than they've been for many years.
Wonderful. Wonderful. So to conclude, you spoke about the 5 big hormones.
Yes.
Right? Progesterone, estrogen, testosterone, DHEA, and thyroid hormone.
Yes.
5 biggies.
Yeah. Let me make a couple more comments about estrogen.
Okay.
Estrogen tends to be produced in our fat cells, whether we are men or women. So if a male comes to me and he's even 5 or 10 pounds overweight, I'm going to check his estrogen level. And I've had couples come in where the husband's estrogen level is significantly higher than the wife's estrogen level.
Wow.
And so the wife needs more estrogen, the man needs less estrogen.
They might just have to kiss more and exchange estrogen.
You think that'll do it?
Well, I'm asking.
Good luck with that treatment protocol.
Yes. Yes. Question?
Yes. So you stated earlier about the period of time it's appropriate for women to have babies due to higher estrogen levels, higher progesterone levels. So why is it not okay, or what are the health risks that can occur if you choose to have children later down the line,
Okay.
like in your late 30s or early 40s?
Well, I'm not saying that women older than 30 shouldn't have children.
Right.
However, if you're going to do that, it makes a lot of sense to have your hormones checked and properly balanced, because if you have low thyroid, that will tend to trigger miscarriages and or infertility. If you have low progesterone, that will also tend to trigger miscarriages.
Well, we generally recommend that for women who at that age want to get pregnant, they need to do a detox, get
Yes.
their nutrient levels
Yes.
up, their hormone
Sure.
levels to the right level,
Sure.
so that the baby
Yeah.
and them is not compromised during pregnancy.
Yeah, and keep in mind that if you're younger than 30, you can still have hormonal deficiencies. I mean, I treat kids with low thyroid, okay? I treat teenage girls with low progesterone, okay? And so just because you're younger than 30 doesn't mean you shouldn't have your hormone levels checked. It's just that past the age of 30, that's when we more consistently start seeing these low hormone levels.
Yeah. Well, that was Conversations with Dr. Johnson, the last one for this week. Again, we'll be on next Tuesday
Okay?
with Conversations with Dr. Johnson. So, Dr. Johnson, thank you for your time today.
My pleasure.
Educating us on, what did you call them, conductors of the body orchestra?
Of the biochemical symphony.
Yeah, the biochemical symphony.
That's taking place inside our body.
Wonderful. Thank you
Yeah.
for that, Dr. Johnson.
My pleasure.